worst is when you have a patient and you're like, all right, take your pants off and you leave underwear on. I'm not wearing any underwear.
Oh my god.
Cool, you're about to make it real weird for all of us.
And that's it? You just keep
I
going.
mean, they cover them up, but still, like...
No, they're just out.
They got a little tissue over.
Exactly.
They tell you all kinds of things that you don't want.
I think
Yeah.
crazy. Well, I think I would prefer a warning of that other than just having.
It's, definitely a warning is better than going in blind.
And when I was working as a PCA,
I don't think I know a single person who does
oral
it.
temperature, and they wouldn't
Doesn't know what
know
means.
how to take it.
Oh.
Like I'd have to be like, put it under your tongue, close your eyes. Because they're so used to the
The
zapping
forehead
now.
one. Yeah.
All right.
Just bear with me because I'm remembering how to do stuff, okay? How do I do the split screen?
The dual
Dual
button is
button.
in the middle.
Yes, it is.
I'm here.
They both collapsed.
Oh, you get to hit freeze, don't you?
You don't have to. You can just toggle between if you want.
Gotcha. So, which one's this then?
The veins
Oh,
bigger.
JK, sorry.
Not only that, but it also collapses.
The other one looked like it collapsed.
Well, I put too much pressure. That's why I backed up a little bit.
She tried
I was
earlier.
pushing hard, yeah.
So that's the first one.
All right, I don't know if I'm gonna do the labels because that might take too
I
long.
wouldn't do labels either.
All right, so
Because they know they
then-
got to write comp on the other side. You guys do the labels, but
Yeah,
for
yeah.
her not to do the labels. Because she's taking up your time right now. Right?
So, which one's this?
Artery.
And then what's this? Yep. So this is the saphenofemoral junction. SFJ with real-time color.
You
Like
said
that.
common is the same as superficial, right?
Nope.
No.
Watch.
No.
We're in the common right now.
Common.
So what's right there?
That's
Superficial, deep.
Superficial deep.
Yep.
Was there another word? for
Superficial, deep.
Or is it just?
No.
Profunda.
Deep is profunda. Deep in your
Okay.
books it says
Yep.
profunda sometimes, but we just say deep.
Okay.
I don't need to be that crazy. It's probably
Vein,
Dr.
vein,
Profunda.
artery, artery. Does everyone see that?
Mm-hmm.
Vein, vein, artery, artery. And then we're gonna go down a little bit more to just get more of the proximal femoral vein. With her, I can still see her deep, but I am definitely further from the junction, but her deep is still right there. So this is more proximal. This would be mid.
Remember, I have
Ooh, look at
going.
that little
You
valve
get
right there.
A lot of your pictures in the groin, so you may think you're at mid, but you gotta look at the legs.
That's cute.
It's so cute. All right, this is the tricky part. Right around here, you hit that adductor canal, and it just kind of goes away. You can still see hers pretty well. My greatest advice to you is going more medial and kind of scooping into her leg. So I can still see it. It's still compressing. Deep will always be a little bit crummier of a picture. We understand that because you are just going that much deeper. So right there. And I will tell you, this is the most tender spot on patients. Patients will tense up on you. If that's the case, you do a, all right, take a breath in, take a breath out, and then I do a one, just one and done. Boop, just enough to show it's compressing. Now pop in transverse. So I'm gonna go behind her knee. Whatever, I'm used to it. This stuff gets everywhere. Remember, we're going behind the knee, so it's gonna be a lot more superficial. Right there. Artery, vein, just artery. I believe that is all of the
Now you just
transverse.
just do the bifurcation of the arteries.
So you're going to order
Vein and
this?
I am, yeah. If you go in whichever order
Makes
makes
sense.
sense to you, I am doing it because I can't think that much right now.
So you did all transfers.
I did.
Now you go back to
So the pop teal's the bigger one.
Okay.
The pop teal vein is the bigger one. So
It was
that
Right.
first artery that comes off that little one is the gastrocnemius. We're not paying attention to that right now.
Common femoral
It's always
artery.
gonna come off, and it'll come off anywhere behind the knee. Yeah, so you're gonna show that frozen.
Oh, frozen.
Yeah, we're not doing.
That's
We're
fine.
not doing flow yet. And then why is the deep blue?
Because it's going away from
Yeah.
transducer.
Down
Correct.
to-
Alright, so they're gonna label all three of those, and then you're gonna get a spectral in that superficial film.
So what's this one?
Common.
Common.
Mm-hmm.
Superficial DVT.
Correct.
Okay.
Now,
It's the pulse wave with a measurement of PSV.
right at that proximal part. Hold on. Hold on. Hold on. There we go.
Where's your cursor?
Why is it triphasic?
Respiration.
In the
Mm-hmm.
superficial.
Not respiration.
Yep.
What'd
It's
you
alright.
say?
Because it's an artery.
Cause it's an artery.
Yes.
And why is it high resistant?
Because it's supplying blood to
Extremity.
extremities.
Not organs.
Yep,
Not
not
important.
organs. Yep.
Mm-hmm.
And
In the
that-
grand scheme of things, your legs are not important. In the grand scheme of things, your heart and brain are going to be way more important.
Fair enough.
So this is the confluence of the two veins.
Confluence means the opposite of like bifurcation because those were traveling up the body. So two vessels come up and they turn into a confluence as they're bringing blood back up.
So would that
Oh,
kind of be the back to cerebrovascular?
yeah.
Would be kind of the same where the
All of your long stuff is
arteries
right
go
here in the
into
groin.
basilar? That would-
Literally all of it. Okay. Yeah.
That's kind of same thing. Yeah.
Okay.
I'm trying to think for a second. What? You looked
I
at me like I
no
had
no
a
no no
question.
no. I was listening to what you were saying, but I also said I didn't realize all the longs are right here in the groin.
Yeah. All
So
the
you could
longs are
get-
in the groin.
Quite a few pictures all in one if they have the anatomy for it.
And then
This is a
so-
distal CFV. I moved down a little bit. There's the bifurcation.
So when you get when they just need to show a phasic waveform. in
Guess
the
what I'm
veins.
doing? Heel toeing.
Okay.
I'm heel toeing. Heeling. Toeing. Heeling. Toeing. All right. Anything else you guys want me to show you? Oh wait, GSV. So, junction. That's our greater saphenous. Follow it out.
This is you go all the way down.
Oh, I ran out
So
of
the
gel.
saphenous is the one where you follow it down
Yep,
and do the
follow and gives us
compressions.
clips, yep. Just give us clips as you go.
And are you just like phrasing as you go?
Clips. So I am. Are we doing compression clips? We are.
Yes.
So we're doing compression clips. So, see, I like retrograde for this. But what you want to do, hit acquire and then slowly start moving. If you don't feel comfortable doing big movements, don't. You can literally be like this.
All we're
I'm not,
trying to get you
I'm
used to
barely
is
moving. I'm
compressing.
boop, boop,
Is
boop.
there like a maximum or minimum number of clips you want?
I would say don't do more than 4.
Yeah,
4, I would say 4 is a good one.
yeah, and you guys aren't gonna probably make it to me, and that's fine. We're not trying to judge where you are.
No, it's
Your first
mainly
go-round with
it's
legs.
mainly following it and then keeping it centered as much as possible.
That's what we're trying to
Yeah.
come across
You're
here
saying
with
4
that.
requires. Down
Yeah.
the foot? Okay.
If you can do less, cool. But yeah, at least do 4.
Where are we trying to stop it?
Right about the knee.
Right about
And I will warn you, when you're right up here in this junction, you will see 2 vessels go off. It's always the more medial one. This right here is your anterior accessory. If you follow it, it'll literally run more anterior. Like look, I am going more on the top of her thigh, while this one is going more medial, or her inner thigh.
And sometimes you'll see that one
Yep.
split again up there because then another one comes off of it and it's the posterior accessory, but it'll die. So stay with the one that's in the Egyptian eye that we talked about, the fascial layers, okay? That's how you can tell you're in the right one.
Anything else you guys want me to show you? I mean, I can also show
Isn't
you
there a
on your
longitudinal?
machine. Yeah, but all of them are right there in the groin, so I just did the main ones, kind of.
Okay.
Yep, yep. Nothing? All right, get scanning.